Imagine a world where there was no need for organ donors, where lost limbs could be regrown in a few days, and where most people live to be well over 100 years old. What if I told you that this reality isn't that far away? My name is Dierickx, and in this presentation I'm going to talk about the field of regenerative medicine and tissue engineering, which is revolutionizing the way we approach medicine. First, let's watch a short video.
We're all getting old. Yes, even you. More and more of our population are over 60, some living well into their 90s. And as we live longer, our joints, organs and tissues begin to fail, thereby diminishing the quality of our old age, not to mention the societal cost of lost productivity and long-term care. Our current medical technologies allow for extraordinary feats of augmentation and replacement, transplantation, pacemakers and artificial joints. Regenerative medicine goes further, promising the repair of dysfunctional body parts with our own living tissue.
In 2008, the National Academy of Engineering identified 14 grand challenges for engineering in the 21st century. One of these grand challenges is to engineer better medicines. Regenerative medicine falls within this grand challenge as it relates to the ability to cure and rehabilitate patients after injuries or illnesses that would currently be fatal or extensively debilitating. While this may seem like a task for doctors and cell biologists, biomedical engineers are also critical to achieving breakthroughs in this field, as a combination of bioengineering and biomaterials are required to create successful regenerative techniques. The field of regenerative medicine is relatively new, as the required technologies and understanding of cellular processes have only become available within recent decades. In the 18th century, scientists began viewing living organisms as biological machines, and many experiments were conducted to better understand the capabilities of cells and tissues. By the 20th century, the first successful organ transplants were undergone, and by the 1960s, scientists were becoming increasingly interested in the idea of stem cells, cells with the ability to differentiate to any specialization, which can then be used anywhere in the body. In recent decades, the focus of regenerative medicine became less about repair and more about regeneration, something made much more possible with stem cells because it has given scientists the ability to manipulate their function and use them for all kinds of purposes. One of the most commonly used techniques in regeneration is the decellularization of organs and tissues, and then recellularization for transplantation. This technique allows an old organ or tissue to be broken down and used as a scaffold, and recellularized so that there is no issue with immune rejection in the patient. While decellularized scaffolds have proven to be very useful, there are still some limitations that prevent the technique from currently being able to produce viable organs. Instead, researchers are trying other methods, and a very promising technology is that of the bioprinter. These have given way to the ability to produce 3D printed organs, and several biological printers are already being produced. 3D printing also presents some challenges, as it is very difficult to produce sufficient vascular tissue for the blood flow required for a functional organ. Regenerative medicine techniques are often referred to by the acronym TERM, which stands for Tissue Engineering and Regenerative Medicine. There are two main factors that need to be considered in order for TERM to realize its potential. First, the technology needs to be available and functional. A lot of artificial organs and tissues that are being made right now may be structurally correct, but are unable to communicate with other cells and function from a mechanical standpoint, so they would not work as fully viable organs. For example, while the technologies exist to create the cells and tissues of a heart, they need to be put together and be able to function with the rest of the body, so right now those technologies don't quite exist. The second factor that needs to be considered is that these products need to be able to be produced on a large scale and low-cost rate. The ultimate goal is to have these technologies available to everyone and to be produced quickly and effectively. Some of the obstacles for this is the requirement to have FDA approval, which would be aided by a common component or material for all TERM products. At the 2014 Regenerative Medicine Foundation Annual Conference, a roadmap was proposed to address the needs of the industry. The elements of this roadmap focus on the manufacturing and widespread production of TERM therapies, addressing the concepts that would allow current and future technologies to be available to the general public, and addressing the need to provide sufficient education and training at the professional levels to support the higher demand of the industry. Similar ideas have been proposed to get 3D printing on the market, as there are several steps that need to be achieved for mass production, considering factors such as cell availability, FDA approval, transport viability, and the difficulty of mass production when every product is highly specialized and patient-specific. Ultimately, if these elements can be realized, it will go a long way in overcoming the greatest challenges in regenerative medicine. Overall, the field of tissue engineering and regenerative medicine is a rapidly progressing industry with countless innovations being realized each year. There are already countless technologies that surpass what was once believed to be the limit of human biology, and researchers are growing ever closer to overcoming the grand challenges of tissue, organ, and limb regeneration. While many roadblocks still exist from technological and manufacturing standpoints, the future of this field, and by extension mankind, is promising.